So, when are you considered to have high blood pressure versus normal blood pressure? Basically, you have normal blood pressure if it's less than 120 over 80. Elevated blood pressure is considered 120 to 129 over 80. And high blood pressure, stage 1 hypertension, starts at when your blood pressure is 130 over 80 or higher. And basically, if you're taking medication for high blood pressure, generally the goal is to get it below 130 over 80. Now, that's in the United States. Other countries sometimes consider your blood pressure to be normal until it's 140 over 90. It depends on the country. But in the United States, generally, normal blood pressure is less than 120 over 80. And that's based on studies showing that when your risk of having heart attack and stroke start increasing, it's best for you from a standpoint of decreasing your risk for your blood pressure to be less than 120 over 80. And so basically, though, when you're getting your blood pressure checked at the doctor's office or at home, you want to make sure that you haven't had caffeine or exercise or been smoking in the 30 minutes prior. And you want to make sure to be sitting or resting, just hanging out for at least 10 minutes because when you're in a rush or stressed out, or if you've had caffeine or exercise or smoked recently, all of those things can transiently raise your blood pressure, and that could end up making your blood pressure higher, reading higher than it would have been, if you had waited a little bit. And so definitely, wait at least 10 minutes while you're sitting to get your blood pressure checked, so that, you've calmed down if you had rushed into the doctor's office. And make sure not to have caffeine or smoke or exercise immediately before getting the 30 minutes prior to getting your blood pressure checked, because that can make it seem falsely high, because those are normal times that your blood pressure can transiently increase. If you're checking your blood pressure at home, make sure to get your blood pressure cuff checked against a doctor's office or your primary care provider's office to make sure that it's accurate. Because a lot of times, home blood pressure cuffs, the range is all over the place because it's not standardized. And so you do have to make sure that, it is actually reading your blood pressure accurately. And so you should check it against having your blood pressure manually checked versus like the automatic one that you use at home.